Good morning. Welcome to this episode 3 of the videos that we're doing. And you'll see that today I have a lovely lady with me by the name of Lynn Furber. And she's here today to help me explain to people why mediums need to always be ethically and morally aware. And I've spoke to people on this over the years, many years, that we end up picking up the pieces of mediums that are unethical and that are damaging the recipients and these people that are in such a vulnerable place. We've brought Lynn along today basically to help us understand why we need to do it correctly. So let me just very quickly introduce Lynn to you so that you know why she's here. She is the CEO of a company called Healthcare Communication Matters, and she's been a nurse for over 25 years. Now, on top of all of that, which already makes her qualified, on top of that, she's also obtained a PhD in healthcare communications. This has enabled Lynn to actually teach communication skills to all the healthcare professionals to an advanced level, including nurses, doctors, consultants, and so on. So Lynn has come along today as an expert in this field, and this is why I've invited her along, because I wanted to delve deeper into what damage can be done and why we have to do it right and be taught right from the very start of our journey why mediums should be taught this ethical and moral standard so that we don't damage people. It's one of these things that I keep seeing over and over again. And I know I'm not going to change things massively, but hopefully today people will understand by looking at a deeper level of this, why it's so important and why I wanted to do a full episode on it. So firstly, Lynn, can I say welcome and a massive thank you to you for giving your time today to do this for me and with me. It's so important that people understand from a perspective like yours, from a professional perspective, the mindset of people that are grieving and are vulnerable. So if it's okay with you, could you just let everybody know a little bit about what you actually do and what your profession is? Is that all right?
Yeah, of course. Thank you, Kaz, and thanks for inviting me here today. I just need to apologise up front. There's a pigeon up on my roof cracking, banging away. So if you hear any
Perfect.
noise, it's not me doing anything. It's this pigeon on the
That's
roof
perfect.
attacking. Yeah. So as you said, I'm a nurse by background. I'm still registered, but I don't practice. But my background was in cancer and palliative care. So I worked with a lot of people who were going through traumatic times, and and a lot of those people sadly died along the journey. So I've
Yeah.
been around death a lot through my career in that
Yes.
perspective. And I did a PhD on how to have difficult conversations with patients who were progressing in terms of their illness and were approaching the end of their lives, and work with doctors and patients, see how we can learn from their experiences, and what we could do for the training of healthcare professionals to make these difficult conversations better. So I think I've observed well over 100 to 200 consultations with healthcare professionals and patients within that kind of sensitive remit of a clinical consultation where they're getting bad news. Yeah, and as you say, I'm trained to deliver communication skills to an advanced level to healthcare professionals. And, I suppose it's similar with you. A lot of people go into these professions, but they receive very little training in communication skills.
Yeah.
And yet it's fundamental to what you do. I mean, it's
Mm.
often I'll have somebody say, I've been a nurse for 20 years or I've been a nurse for 30 years. Why have I never been taught this before?
Yeah.
I've had consultants sit there and go, oh, so I can talk to my patients and do it
Yeah.
this way and achieve the outcome that I want. So I guess, when we're dealing with people that I think that, yeah, the common goal is that we're dealing with people who are vulnerable.
Exactly.
In your world, you're dealing with people that have lost somebody that they love
Yeah.
and care about and want some answers to that. And for me, I'm coming at it from the angle where the patients are approaching the end of their lives and then they've got questions around that and things to process. So everything I think key to what we do is having that sensitivity and empathy towards somebody.
Yes.
Um, but I can talk about that a bit more as we go
Yeah, yeah.
through.
I mean, I can imagine that some of the conversations that you have to have are incredibly difficult.
Yeah,
Um,
and one of the I suppose, yeah, there's a lot of different challenging conversations people have, but one that comes up quite a lot is, if somebody says to me, "How am I dying?" That is a really difficult one, and people will try and pass that off or,
okay.
"Oh no, don't worry about that." And actually, that's wrong. If somebody's asking a question, and I guess this is a point that will be relevant to you. If people ask a question, they don't always expect an answer. Sometimes they're just processing thoughts within their head. So for that kind of question, am I dying? It's acknowledging that question. That sounds like a really important question to ask. What
Yeah.
makes you ask that today? So I don't know what questions you might have, but I
Yeah.
think instead of going in there and thinking you've got to jump in and answer a question or try and provide evidence to that question, acknowledge that question first. That's
Yes.
important that you ask that.
Yeah.
I'm wondering what makes you ask that.
Yeah.
And
And I
gather
think,
that information first before jumping in and saying,
yeah.
because you can get things wrong.
Oh,
And
absolutely.
if I may, there was just, in healthcare, progression the word progression is used a lot. To a healthcare professional, progression isn't a positive word. It's indicating that things are getting worse in some way or another.
Okay.
But a lot of people think progression is, oh, that's positive. That
Yes.
it's progressing in the
Yeah.
right way. There's a positive steps happening where. So sometimes you're thinking if there's any jargon or lingo that you use that could be
Mm.
interpreted in different ways. I think it's sitting back and having considering that. Oh, how
Yes.
might this word be perceived?
Yeah.
Could it be perceived differently to what I interpret it to
Mm.
mean?
And I think, from a mediumistic point of view, being a medium who's dealing with grieving people and people who are in probably one of the most vulnerable stages of their life, which is, the people that we deal with on a daily basis. It's knowing what you can and what you can't say. I hear the horror stories of people that are told by so-called mediums, make the most of this time you've got with such and such a person because they're not going to be here any longer. Or they talk about things that are just so unethical. And these people, I don't think they get, and this is the sad part, I don't think they get the damage that can be done by saying things to people that are damaging, because it's not just saying it in that moment, it's the lasting effect that can have on somebody's mind, going forward and probably for the rest of their life as well.
Yeah,
And it's trying to get people to understand that this should be taught, just like in your profession. It should be taught from day one of how to speak, what you can and what you can't say. Now, I know that one of the things that I heard you mention there was that if somebody asks a question, sometimes you have to not skirt around it, but acknowledge that question. I think in mediumship, we've got to sort of follow the same principles, but maybe in a slightly different way. Because if somebody asks a certain question, you can't always just turn around and say. So let me give you an example of what I mean. I had a lady once who came, and her son had committed suicide, and we were connecting with her son. Her son had stepped forward, and the mother wanted to ask a question and said, "Was it my fault?" Now, ethically and morally, I couldn't say to her, yes, he blames you, because number one, he didn't. But there have been people that I know that have said things like that. Yes, it's your fault. This is saying it's your fault. Now that mother has to live with that for the rest of her life, and the damage that you will understand, as you know, even more so, the damage that that can do to somebody in that moment of her grief. And it's, it crushes you as a medium to think that people are out there saying these detrimental things. So I was going to ask if it's all right with you, to ask you some questions, sort of relating to the grieving person, the vulnerable person, and how we can learn to speak to them rather than just come out and say these detrimental things to them with no filter on it. Does that make sense?
Yeah, but I think I want to just address that first
Yeah.
because it's pertinent to. I think again because I come from a healthcare perspective, I might give
Yes.
some examples of that because that's my
Perfect.
field. Um, I think people get flippant and they get so um, once-minded. I'm trying to think of
Mm.
the right phrase. I can't think of it. They forget that they've got a human being in front of them.
Yes.
And a key thing that I am repeatedly saying, if I had £1 for every time I say this, I'd be a multimillionaire. Step into somebody else's shoes, step onto somebody else's planet,
Mm.
and appreciate what this is like for them. So those flippant throwaway responses really damaging.
Yes.
Um, and in the healthcare world, people saying, "Oh, all you women worry about is losing your hair," or "Well, you've got to take what life throws at you." That's really damaging, and it lasts with
Mm.
people, and it has really, really serious consequences. And I think in the example you gave about telling somebody about, yes, it was your fault. Who are you serving there? What is the purpose of that?
Yes.
You've got to be empathic, and to be empathic, you've got to have a desire to step into somebody else's shoes and see something from their perspective.
Mm.
There's a difference between sympathy and empathy. Sympathy is about you. And it's like, oh, I understand how you feel. I think I would feel like that if I was in that position. That's about you. And it should never be about you. It should be about them. So, who
Yeah.
is the person who is sitting in front of you? And they should be your priority, and your focus should be on them. So, empathy is having a desire to appreciate something from their perspective and trying to make sense of the verbal and non-verbal cues that people give us. So somebody might say something either, "Oh, I'm not quite sure what that means. I just need to explore that a sec before I address it." Or they may, sitting crying or sitting twitching in their chair or whatever. Those are non-verbal cues that something's not quite right. They
Yes.
might be agitated, might be looking around a lot, they might be really
Yeah.
shifting in their seat. Those are all non-verbal cues, and you've got to pay attention to that.
Mm.
And then say what you see or say what you hear. I can see that this is difficult for you, and I can see that that's a difficult question to ask,
Mm.
and just sit with it. Often people think they've got to talk incessantly. And I know in your field you do have to talk because you're trying to
Yeah.
convey messages
Yeah.
from spirit world to your client. But some of you've got to consider the pace and that of which you do
Yes.
this too. And if people have this physiological reaction to information, so when they're um, as we're talking now, we're working within the frontal cortex of our brain. So we're being creative, we're thinking, we can be rational in terms of what we're saying. If somebody's emotional,
Mm.
be it anger or in a real distress, they switch from their frontal cortex to the amygdala, which is towards the back of the brain.
Okay.
And in this area, they can't process what is being said. And so they can't hear you, they can't take that in. They're dealing with the emotion.
Okay.
And often people, if they're really distressed, they will look down. And so it's and then there's an indication that they're ready for you to say something more when they look up at you. So
Okay.
don't be afraid to sit in the silence. If something's going on, with their behavior that
Yeah.
indicates they might be in their amygdala. They're kind of they may be also within a flight, freeze, or I can't remember the third one. Flight, freeze, uh, or
Fight.
fight,
Fight.
fight,
Yes.
fight response. So you kind of have to go at a slower pace to
Mm.
enable them to process what's going on in their brain so that they can come back to their frontal cortex.
Okay.
So that works well within that empathic kind of response too. Does that make
It
sense?
does. It's absolutely makes sense, and it's a really wonderful thing to hear you saying this, because it show it shows that there is this possibility to bring this into mediumship, into the teaching, that if people sort of understand what you've just said there, that we have to look at the cues of the person that we're reading for. Are they acting the way that you've just said? Are they showing signs of distress before you even start? Or do they start to develop this stress throughout the reading? And I think a lot of it comes back to the medium to be, again, like we said earlier, to be aware morally and ethically of what's going on with the recipient.
Yeah,
So if we
definitely.
start to see this, one of the first questions to me, we should be saying to them, are we okay to carry on? But I think this is something that a medium has to learn, these cues and these trigger things that you've just spoken about. We have to be taught this so that, because they are dealing with people that could be incredibly vulnerable. We don't know where they are within their stage of grief. We don't know where they are mentally, emotionally, spiritually within that grief. So we have to take that into consideration, and we have to almost pre-read it before we even start. Does that make sense?
Yeah, it does. And I think there's it's recognizing that people go through. I know if you look back at Kubler-Ross, Elizabeth Kubler-Ross, back in the 1960s, she talks of 5 different stages of grief. And so you don't know what stage your individual is at because you haven't
Exactly.
built
We
a
don't even know
relationship
them.
with them before, yeah, because you don't know them. So I think it's so if it's helpful to just know those stages, you've got denial, which is, this can't be happening,
Mm.
what's going on? This doesn't make sense. You've got anger, and why is this happening to me?
Yeah.
And they're just like they're really angry with them
Yeah.
for
Yeah.
what's
Because I've had
happened or for the
I've
fact
had
that
people
they've
here
left them.
that have been angry with the spirit person.
Yeah,
And they're not really angry with them, but that anger comes out when you're doing a reading with them.
yeah,
So, like, yeah, I
and
see that.
it's like yeah, last summer, my childhood best friend, well, one of my best friends died, and I didn't get a chance to say goodbye to him. And oh yeah, I was really angry with him for.
Yeah.
I was really upset that he died, but I was really angry and that, it ebbs and flows. It's like,
Yeah.
why wouldn't you let me come to the hospital and say goodbye to you? I know I've
Yeah.
got all these things left unsaid that I want to say to you. And actually, I want to just give you a kick up the backside
Yes.
for,
Yeah.
for, um,
So that's
for not
definitely a
letting us
side that
in.
we see through the mediumship.
Yeah. So you've got that. You've got bargaining. What could I have done differently? Is it
Ah,
my fault?
yeah.
Um, and you've got all those questions. I've got a really daft question that I still ask about my dad when he died 25 years ago. There's still this little thing that comes into my head, like as a nurse, oh, should I have pushed that more to get that done? Or,
Ah,
and then you think, well, actually, no. When you can think rationally, and I'm
yes.
in my frontal cortex, I'm like, I can argue, no, that, it's fine. It wouldn't have made the difference at all. But
Yes.
in the moments where I'm not distressed now, but when I think about it, I'm kind of flicking more towards the back of my
Yeah.
amygdala. I'm having cortisol reaction too with that. My hormones are changing, and my cortisol levels are increasing. So that makes you edgy and twitchy.
Okay.
So that's also a physiological thing that
Mm,
somebody will go through. You've got your depression, you've got your deep sadness, and that difficult.
mm,
It's tough to get out of bed and put one foot in front of the other that day, and you just can't
yeah.
deal or talk to anybody. And then you've got acceptance. You accept that this is a new reality, and You just got to take it a day at a time to move on. So this isn't this isn't a linear approach either.
Yeah.
Uh, I remember a vicar once saying to me, imagine he described it as walking along a riverbank and everything's all hunky dory, and then suddenly the death happens and you tumble into the riverbed. There's no water in there, but you've tumbled down into the riverbed, and at that bottom, you're in that depth of depression, you're in the anger, and then you'll start to come up the other side of the riverbed. But it's not a smooth linear path. There's lots
Yeah.
of jagged edges and whatever. So one day you might be angry, the next day you may be a bit more accepting, another day you might be depressed.
Mm.
You've got to go through these different phases. And so I think from your perspectives, because you don't know somebody, maybe it's worth, at that start of the session when you meet somebody, got to build that rapport with somebody.
Yeah.
So you've got your introductions. Maybe you want to give some structure to the session. So this is how it works. This is what I'm going to do. Is there anything in particular that's brought you here today? Blah, blah. But you might want to ask, where are you in the grief process?
Yeah.
How long ago did this happen? So just get some bearing, get some grounding knowledge, so that you can oh, okay, so they might be going through this at this point,
Yes.
or
I
whatever.
think one of
Just
the things that I've noticed with people, and one of the ways that I've sort of been able to gauge a little bit of where we are, is that people that are really suffering in that grief tend to not look directly at me. They
yeah,
they they tend to answer questions and talk to me, but their gaze is elsewhere. They're looking around, and they don't. It's like they don't quite or can't quite make that eye contact. And I had one lady say to me, "If I look at you, I shall just break." So this is before the reading even starts. So to me, that sort of gives me that indication of, right, I'm going to have to tread really carefully here. And I think it's the knowledge of the medium that we're trying to work on here, is giving the medium this knowledge of learning these triggers, learning what's, because I think some, as like you say, some of them out there just don't care. They just don't care because all they want to do is give the reading, take the money, and be done with. They have no concept of the damage that can be done. So if I was to put to you and to say to you, if you have somebody who is in that stage of grief that we don't really know, because we're not in their shoes at that moment, and somebody does say things that are ethically and morally wrong, that is damaging rather than healing, what does that do to a person long term? What can that do to a person?
sure, it can do an awful lot. I mean, um, it could reopen old wounds.
Mm.
It could. I mean, it's hard, isn't it? We beat ourselves up when we've lost somebody. What could we have done differently? What should we have said? Did they know I love them enough? Did they? We have lots of questions and that. And I think if somebody's unethical in their approach and insensitive to
Mm.
that individual, the damage could be massive. I see in healthcare, um, if somebody, well, I'll give you an example to bring this to life. So a patient had he had a cancer, which meant he was only going to live about 6 to 12 months, and the consultant he saw originally said, oh, you'll be all right. You'll live to see your grandchildren grow up, because he was fearful of telling him the consequence,
Okay.
the reality. And when this patient came along to see the oncology doctor, the cancer doctor, she said, no, what have you already been told? Oh, well, I've been told by the surgeon that I'm going to live to see my grandchildren grow
Mm.
up. And she didn't dispute that. When I interviewed her afterwards, I said, you didn't dispute the fact that what he understood about his grandchildren growing up. What were your thoughts there? And she said, well, he'd been depressed before, and he was quite perky today. So I didn't want to destroy his hope and knock him back down to square one again. So I decided not to say anything, and I would come back and have that conversation with him another day. When I asked the patient what he thought about the information that he'd been given, he said, well, I actually thought she was going to tell me I'd got 3 to 6 months left to live, but she didn't say that. So actually, she confirmed that, yeah, I am going to live to see my grandchildren grow up. So I'm going to have one course of chemotherapy after another. It's going to be great. I'm going to be here for years. And I
Yeah.
was like, oh, God, that was such a missed opportunity. If the consultant at that time had have said something to him, they would have been on the same page. The consequences of not being honest at that point was that the patient came back a few months later. Now he's got brain mets. He's been in hospital for an emergency admission. And this next doctor tells him the chances of him being alive in a year are really slim. And it came as a crushing blow. So
Oh,
I suppose what I'm trying to say is there are consequences and long-term consequences if we get the communication wrong. And often we hear people complaining about things that
mm,
maybe happened 6 months ago, 12 months ago. And I think in those situations when somebody repeats a problem,
mm,
then they feel that they haven't been heard. So we need to demonstrate that
yeah.
we've heard what somebody's saying. So going back to the first point, when you're building a rapport with somebody, demonstrate you've heard what they've said. Either summarize what you've told me is you're here because your husband's died within the last few months, and right now you're feeling quite angry about this, but you want to try and make some connection with him today. Is that right? So it's kind of checking
Yes.
that you've
Yeah.
got that right. So that's always important, so that somebody feels heard and understood in that moment. And I think if we don't do it and we are unethical, we are insensitive, and we don't get that grounding, and we don't build that rapport up front, there's going to be, yeah, really big consequences. So we can reopen wounds or deepen them. Um, and often there's unfinished business that somebody's going through. If I'm thinking of my friend dying last year, I didn't get to say goodbye to him. That's unfinished business with me. If
Yes.
I went to see somebody who was insensitive to that, that could make me feel angry even more. And I'd go home and I'd reflect on that and
Yeah.
question and think, oh, I thought we were really close. Does that mean that I wasn't as close to him as I thought I was? And you got,
Yeah. And I suppose that really could then, within your mind, make you question your whole friendship with them
yeah, yeah, and
and the
your
memories.
friendship and relationship. I mean, I'm using it. This isn't quite
Yes.
what happened with me, but I'm using it as an example because I've raised that.
Mm,
You could disrupt, sorry, the grief process.
yeah.
So I've talked about those different 5 stages of grief.
Yeah.
You could disrupt where somebody is within that. Maybe they are getting to a point of acceptance, or maybe they are in that acceptance. Maybe it happened a couple of years ago. But if you say something insensitive, like your example of telling the woman, yeah, it was your fault, he committed suicide. Wow, smash, bang,
Yes.
you've just knocked them from acceptance right back
Way
to
back. Mm,
the start.
yeah.
And there's no coming back. There's no coming back from that.
No,
Nobody
this is
can
the
bring
part
you
that,
back from
yeah,
that.
this is the part that I wanted to get to, is this long-term effect. It's very much like an old story. It wasn't me, it's a story that I heard where somebody was told that you're not going to make it to 30. And this was from a medium. This is telling them that the spirit world are telling them that they're not going to make it to 30. So by the time they're starting to approach 30, they're putting family matters in place and all the paperwork because they've been told they're not going to make it to 30. So that has changed their whole way they live and conduct their life because
Wow.
they think they're not going to live past 30. So that again is something that changes the course of somebody's life because of what the medium has told them.
Yeah. And in addition, we see that a lot in healthcare. When somebody asks about their prognosis, how long have I got left? And somebody say, oh, within the region of about 12 months. Once that person, this person might be doing actually really quite well and
Yeah.
responding to treatment, but they get to that 12-month mark and suddenly they start to take a nosedive because psychologically they've got it in their head that, well, this is my point now.
Yeah.
So anytime
Yeah.
soon, I'm gonna die. And I think sometimes, yeah, I've been around patients for donkey's years that I never liked it when the doctor gave somebody a figure or
Mm,
because you did see such a change in that individual. Sometimes, they started to get lower in spirit, depressed.
yeah,
Um, some people will be like, well, sod that. I'm
yeah.
going to beat the odds there, and that's not going to happen to me. So they'll kick back and they'll fight against it. But a lot of people actually just take a
Yeah.
nosedive. And I think because of what else is going on for them
Mm,
physiologically as well at that point, it just doesn't, it just
mhm.
perpetuates
And
and
it's not just with that
speeds
person,
things
is it?
up.
It's the wider family that they're part
Yeah,
of as well, because
yeah,
they're there then watching that person. So it's not just either the recipient or the patient. It escalates out to the family, to the parents, to the siblings, to everybody else. So everybody is then affected by this information that's given unethically or morally incorrect.
yeah. I mean, it's such a massive psychological burden. But as you say, that from the practical sense, I've heard of people spending all their money because they're not going to be here, but they're still
Yes.
here 10 years
Yeah.
later. You've got insurance to think about.
Yeah.
There's so many consequences to that. And I'd
Mm.
be saying, why did you say that? What made you do that? What was the
Yes.
purpose of that? How was that going to help this individual?
Exactly. Because
Um,
hopefully,
it's
I
really
mean,
unethical.
yeah, from my perspective and hopefully most other mediums' perspective, um, we have this, we have this desire to promote healing, not to damage.
Yeah,
Um, but I think there's an old saying that mediums nowadays are just being produce like a factory line, just produce. They just want, and people are untrained. And even those that are trained, this is the worst bit, even those that are trained still can be unethical with it. They still don't care. Don't get me wrong, there's a lot that do, but there's also a lot that don't. And other people have to pick up the pieces of those people that have been damaged
yeah.
by people not understanding what we've just been talking about and not understanding the damage that can be done. So,
And just
yeah,
adding to that, Kaz,
mm,
you know, just personally, I mean, this is going back probably 20 years, but I had a lot of things happening around me from a kind of a spiritual perspective. I was aware of things happening and people talking to me, and I didn't understand it all. I was scared by it, and I saw this guy, and some of the things that he told me were just horrendous. I
mm,
remember him saying, um, "Oh, you could be a medium if you wanted to, but actually you have no choice. It's going to come and get you if and whatever." And then he started talking about. I remember him saying something around sitting under this. I can't even remember. This is going to sound bonkers because I can't even remember the context around it. But I remember him saying something like, imagine sitting in under the stairs, and suddenly somebody's going to grab your feet and pull you under the stairs, and you're going to go into the depth of darkness. And
oh
that was
goodness,
part of his story and narrative about me entering mediumship. And I was
wow,
like, absolutely sod that. I
yes,
couldn't sleep
yeah,
I couldn't sleep at night. I lived on my own at the time. I'd sleep I'd have the light on all through the night. And I had to go to somebody else to try and
yeah.
to
And that's with
mend
somebody
me
who's,
through
yeah,
that.
who's as with an intelligent background as you,
Yeah,
and even that scared you. And
yeah,
this is exactly what I'm talking about.
yeah.
It's not just the grieving person, it's things that they're saying to them. I mean, I've had people come to me that they don't want to read him, but they've been told by another medium or a medium that they have an attachment, and this attachment is following them around, and
Oh, I've had
they
that.
are petrified. And the psychological damage that does to somebody because they're genuinely walking around thinking they've got something attached to them. And you just think, for goodness sake, guys, what are you doing?
Yeah,
What are
yeah.
you doing?
It has made, yeah, it has major ramifications. And I think, it erodes trust, doesn't it? I think the final thing to say really is that, yeah, that being ambiguous and false in terms of what he's saying, people may not pick that up in the moment, but they will go away and they will digest and reflect
Yeah.
on everything that you have said. And then the doubt starts to creep in. It's like, oh, well, what
Yeah.
did they mean by that? I saw somebody years ago. It was clear she hadn't got a Scooby Doo what about me and what was going on. And I was at a point. It was like, oh, I'm just gonna get up and walk out here because I don't need to sit and listen to this. And then she said something like, oh, but she's saying that she loves you and she's just desperate to hug you. Can I hug you? I was like, absolutely not. I don't want. I didn't trust this woman. I was just like,
Yeah.
no, get away from me. I
Yeah.
guess that's another thing. I don't know whether touch is an issue with you guys too, but a lot of healthcare professionals will say, oh, well, can I show empathy by touching somebody or whatever? I was
I
like,
think that's such a
it
really grey area, isn't it? I mean,
is, and that's where you've got to pick up on the cues from somebody.
absolutely.
So, I see people go in and they'll hug and they'll like, and I'll be like, oh, duh. I'm cringing inside, like, oh, don't do that
Yeah.
to me because,
And then that you've got the other people on the
and then
flip side who really need that hug.
yeah, and something but you can do it if you're uncertain with somebody, you can do it really subtly. So that when you're saying about that person in grief
Mm.
that's looking away and they're not giving you any eye contact, I guess what you could do, is being still and sitting still and being present and waiting for them
Mm.
to make that eye contact connection with you. If you just moved your chair just very, very fractionally forward, if that person's like looking down in particular, if you can move your chair slightly forward, that is an empathic response because it's just saying, I'm with you. I'm here. It's kind of like putting
Really
that
interesting to
that
know.
blanket around somebody to
Yeah,
say it's okay. I've got you. You can just do it really subtly. And
that's
we'll
wonderful
say,
to know.
I guess if with you, if you're working with people online too, just some that moving forwards into the
Yeah.
camera and hand on your chin and your hand or something like that. Just it's just an indication that
Yes, that you're
you're
there.
there. And I think the other thing, just to add with that, is that popped into my head, which may be popping back out again, is yeah. So when the person's not looking at you and they're looking away and whatever, they're probably processing things in their head and they're trying to protect their own emotion and they can't. If they
Okay.
look at you, I think, as you said, if I look at you, I'm going to break down and I'm going to cry. Um, I can be really empathic and I can demonstrate stuff
Mm.
to people. If I'm in a consulting room and I'm getting bad news, don't give me any, definitely don't be sympathetic because
Yes.
I deal with that.
Yeah.
But I become very business-like. It's like, right, just tell me as it is,
Yeah.
because I need to get out. And I'm going to cry on my own afterwards because I'm not going to cry in
Yes.
front of you. So people have different ways of expressing themselves. But the person that's looking down in particular, or looking away elsewhere. They've gone off on some solitary journey in that moment.
Okay.
They don't expect you to go with them, but they
Yeah.
expect you to be there with them when
Then
they
come back.
return.
Yeah.
So you need to sit and make sure that you're giving eye contact and that you're present
Yes.
so that when they do come back to you, because you don't know when that will be, they
Yeah.
know you're still there with them. But if you're looking around and fidgeting and doing stuff, then that's an indication as well that you haven't got
Not,
that
yeah,
rapport with
you've
them
not
that
got the
they'll
empathy that you
have.
need. That's
Then you
really,
might.
really good advice, Lynn. And I think it's something that I think you've said some key things throughout this that, hopefully if people watch this video, they will be able to, especially tutors as well, when they're teaching their students, and teaching these up and coming mediums to be able to bring this into their teaching if they possibly can. And to look for those triggers, look for those signs. I mean, that you said about just moving your chair slightly closer without actually the physical touch, because we have to be careful with physical touch nowadays anyway. but to, unless you say to that person, if you want a hug, I'm here, then you can take their lead from it. But I love that you said about just that little move forward. That is such a key thing that people can take on board if they know about it. And this is the problem, is they don't know what to do. They
No.
don't know because they've never been taught it. So I think some of the things you've said in here have been absolutely key. Looking for the triggers, looking at the response of the recipient and how they're dealing with it. And like you say, just give them that space, give them that time, stop if you need to. The spirit world will understand that they need that break. They know their person better than anybody.
Yeah.
And mediums have got to invest in this type of thing, I think.
Yeah. And it's thinking, I know it's, yeah, because I don't do it. I guess it's, yeah, I don't know quite how it works for you and as a medium, but essentially people think they've got to talk all the time and
Yeah.
they don't actively listen and they don't pay attention. They
Mm.
don't use silence and pauses enough. So on my advanced communication skills courses with healthcare professionals, we go through there's lots of facilitative skills that they can use. And there are also a lot of blockers that will block communication. So we look at all these skills in
Yes.
detail. And one of the skills that a lot of people are uncomfortable with is silence and pauses. Now, silence and pauses for me, and empathy and acknowledgement, they're right at the very top of
Yes.
the facilitative skills. And so we'll say, well, okay, then you try some, when you work with the actor, because they'll do some role play with a professional actor, let's incorporate some silence and pauses in with that. And let's see what happens and see how that feels. And sometimes they'll say, oh, that silence felt really long. And then you'll go to the actor who will feed back in role
Yeah.
and how they feel in that moment. I'll say, oh, what silence? I wasn't aware that there was a
Yes.
silence or a pause. And
Yeah.
then the more they practice it, they're like, oh my God, silent. And on evaluation sheets, it comes up all the time. Silence is golden.
Yeah.
And so so you so you've got to think about the pace of
Yes.
what you're doing it. So slow down.
Yeah.
I don't think you've got to give lots of information and just keep talking, because
Yeah.
you have to be present in the moment,
Yes.
and to be, it's hard work being present. And I guess for you, you're communicating with spirit and trying to translate that and convey
Yeah,
it
it's not
to an
easy. It's
individual.
not easy.
It can't be easy.
Yeah. And I think
So
also
it's just being
it's
present.
that stepping into the role of the person. Would you want to be told that you've only got to live till you're 30? Would you want to be told it's your fault somebody's committed suicide? Do you know, would you want to think about the words that you're saying? Think about the impact that your words are going to have on that person. Even though the spirit person may be saying things, and being really honest, there's times you just can't say everything that you're being told.
Yeah.
And
You've
I
got to
think
be
sometimes
sensitive
you've got to
to
be
that, haven't you?
really, really um, cautious. So thank you so much for your time. Thank you for your really valuable input on this. Um, I will try and put a link at the bottom of this video, if it's all right with you, to you, so that if anybody has questions on this or said, I don't know how to deal with that, maybe you could probably, just offer a little bit of advice or whatever. But I can't thank you enough for giving, your opinion on what to look for, what how the person's reacting is key. And it's certainly, and I thought I got it quite well until I heard some of the things that you've just said. So I've learned a massive amount from this, and I hope that other people will as well. So thank you so much for your time.
You're welcome.
Um,
And I guess I'd just say, so that people don't feel overburdened or worried about it, just go in with the intention that I'm going to try one thing today. I'm going to try and do this element of it better
yeah,
and see how that feels, and then try another bit and see how
yeah,
that feels.
yeah,
Just so that you don't. But if you're watching this video and some of this resonates with you, then just be mindful, oh yeah, I'm going to try this, I'm going to try this, and try and do it sooner rather than later, because the longer you leave it, you won't change your practice. You'll
Yes.
still remain as you are.
Yeah.
And I guess just in summary, I would just say, it's key to build that rapport with somebody as soon as they walk through the door. Those first impressions are made within about 3 seconds
Yeah.
of meeting. Try and provide some structure as to what is going to happen, because they'll have questions in their mind in terms of what's going to happen. They may be fearful, so
Yeah.
you've got to try and put people at ease. So put some structure in there, gather a bit of information about them, find out where they are in the grief process and what's brought them
Yeah.
today, and then deliver that information sensitively, carefully, and with empathy, and use that empathy and be attentive to the emotion
Yes.
throughout. And then don't leave on a cliffhanger or something, really
Yeah.
bad. You've got to try and bring it down to a more neutral space before you bring it to a close.
Okay. Perfect. Absolutely priceless information. So thank you once again, Lynn, for doing this for us. It's massively appreciated. Um, And to those that are listening to the video and those that may recognize some of this within their own mediumship, please don't beat yourself up if you've done some of the things that we've talked about,
No,
because remember that, we're all learning. It's a learning journey all the way. And this is just another step on the learning journey. And we can all take something from this. So again, thank you, Lynn, for your time.
you're
Take,
welcome. Thanks,
take
Taz.
care. Bye bye,
Thank you.
everybody. Bye.